still led me to see the situation in India was very scanty.
Capability or capacity of the brain is also decreasing.
Brain has changed for the negative.
With devastating and yet untreatable diseases of the
Most of the victims then had no option but to suffer in silence. The brain is the most complex and truly extraordinary thing in the universe. On one level, it's a billion collection of cells communicating in trillion connections, chemical and electrical synapses. And on another level, it's the totality of all things. When a newborn first comes into the world, its brain only has about 7,500 connections between neurons. Changing day by day, the brain's neurons would have dramatically increased to more than double the connections of a typical adult brain just by the age of 2. It was long assumed that once the brain was injured, it could not change, could not heal. As new treatment techniques emerged, so did new outcomes. The findings gave rise to the idea of neuroplasticity. Different pathways form and are created and are discarded, all according to our experiences. When we learn something new, we create a new connection between neurons. We rewire our brains to adapt to new circumstances. Brains are constantly growing, developing, and changing. Each new experience prompts a change in the brain's structure, function, or both. In the 1960s, it was discovered that neurons could reorganize after a traumatic event. So does this mean traumatic events are related to the brain? I had begun my research on neuroplasticity, but all I could really find was that it was the ability of the brain to reorganize. There had to be more to this phenomenon.
A lot of research on neuroplasticity has happened in the last couple of years, and most of the research has conclusively demonstrated that neuroplasticity is a concept which has a lot of potential, and a lot of patients have had a lot of benefit from neuroplasticity.
There are millions of neurons at birth. Previously, researchers thought that there is neurogenesis, that is, generation of neurons will occur only in early ages of life. But recently, it is found that there is neurogenesis even in the adults. So, this is the basis for the neuroplasticity. Neuroplasticity is nothing but the regaining the lost function of the brain. This occurs due to increase in the synaptic connections, neurogenesis, and increase in the number of dendritic connections and other astrocytic cells that are present in the brain. There are two types of neuroplasticity. There is a functional neuroplasticity and a structural neuroplasticity. Let us know what is a functional neuroplasticity. For example, when there is an acute insult to the brain, some part of the brain, that might be due to stroke, that is sudden loss of supply of blood to the brain, or because of head injury or any other infection or any cause of any tumor, that will cause loss of function of some part of the brain. That function is regained by some other part of the brain, that is because of neurogenesis or because of synaptic connections or because of increase in the number of dendritic connections. This is called functional plasticity. But what is structural plasticity? The structural plasticity is nothing but the lost function of some part of the brain is taken over by some other part of the brain. That is called as a structural plasticity.
With over 60% of the worldwide population experiencing trauma at least once in their lives, it is safe to say it is incredibly common. When the brain experiences a traumatic event, our working memory is significantly compromised. Prolonged stress can wear down the prefrontal cortex, pathways are damaged, and neurons are compromised. Neuroimaging has shown that people who have experienced trauma have problems in the mid-prefrontal cortex, which is related to fear conditioning and extinction learning.
In trauma part, there are three types of head injury. One is grade 1 head injury and another is grade 2 head injury, and there is grade 3 head injury. In grade 3 head injury, there is a irreversible or permanent damage of the brain, in which we'll see there will be a very minimal adaptation of the brain, which we'll call it as neuroplasticity. In grade 1 and grade 2, we can see there is a good improvement in the patients and all this because of adaptability of the brain. So in many head injuries, we have seen this neuroplasticity, adaptability of the brain. For example, we'll take in any minor car accidents or in any concussion syndromes. What is concussion syndromes? Concussion syndrome is sudden jerk of the head. Jerk of the head will cause concussion syndromes. Means it will cause depression, anxieties or amnesias or small memory defect. In this type, the neuroplasticity will play a huge role, and we have seen 10 times increase in the neuronal circuits and chemicals and synapses in this type of. But in grade 3 head injury, there is a huge car accident or a big accident in which there is a part of the brain has been damaged. In that, neuroplasticity is present, but because of permanent damage or irreversible damage, the repair is very minimal. Means adaptivity of the brain is very minimal compared to the grade 1 or grade 2 head injury.
Depends. Traumatic brain injury can encompass a wide range of things. You can obviously have a fatal injury from traumatic brain injury, either secondary to injury in very important locations in the brain, like the brainstem or the midbrain, or diffuse injury throughout the brain. You can have injuries to the vessels that are very important, certainly supplying blood supply to the brain, which can lead to strokes or hemorrhages, both of which can be fatal if not treated. And on the flip side of that, you can have kind of a very minor injury, what we can consider concussions. And those injuries are basically either slight damage to the brain tissues themselves, or the brain tissues get stretched. They release certain inflammatory chemicals that result in kind of minor injury. And after something like that, you can still have kind of vague neurological complaints. People often complain about what we call post-concussive syndrome, which is a constellation of symptoms that include difficulty with sleeping, difficulty with concentrating, dizziness, sometimes some difficulty with gait, some minor headaches. So the various cognitive abilities are very broad depending upon the degree of injury.
With as many neurons and as many connections as you're going to need, they can go from any spot of the brain to every spot with as many connections as possible.
And that's a brilliant design by Mother Nature, because it gives us this incredible amount of possibilities for the future.
But there's a catch. That gift of possibility doesn't last forever.
Next, nowadays we are seeing many depression in kids, followed by memory disturbance in kids, in which there is a decrease in neuroplasticity.
Researchers have found that certain parts of the brain in a depressed patients are less in volume or less functional. These parts of the brain are hippocampus, prefrontal cortex and amygdala. They have found that number of synaptic connections, number of dendrites and number of neurons in the hippocampus are less in the depressed patients. And they have also found that the apoptosis of the cells is more in depressed patients in these areas. So there is a decrease in the neuroplasticity in a depressed patient.
నా పేరు వసుమతి దేవి. నా ఏజ్ 86 ఇయర్స్. ఒక 7 ఇయర్స్ వెనుక నాకు ఫ్రాక్చర్ అయింది. కాలు లోపలికి ఇంటి లోపలికి వస్తుంటేనే ఫ్రాక్చర్ అయింది. ఇట్లా పడిపోయినా కొంచెం కాలు జారింది, పడిపోయిన తర్వాత ఇక నేనేం చేయలేకపోయినా, ఇక ఇంట్లో డ్రైవర్ వచ్చి నా కూతురుకు ఫోన్ చేస్తే హాస్పిటల్కి తీసుకురమ్మన్నది. కార్లో హాస్పిటల్కు వచ్చేసిన. 40 కిలోమీటర్ల దూరం ఉండే. అప్పటికి కార్లోనే వచ్చేసిన. ఇక వచ్చేసినాక తర్వాత వాళ్ళే ఎక్స్రే తీసిండ్రు, ఒక తెల్లారి ఆపరేషన్ చేసిండ్రు. మంచిగా అయిపోయింది. కానీ నాకు ఒకటే భయం, నాకు ఎప్పుడు ఏం కాలేదు. ఇది ఈసారి అయ్యే వరకు నాకు పెద్ద భయం అయ్యింది. నేను ఇక మంచి గాను అనుకున్నా. నాకు మంచి కాదు, ఇక నేను ఇట్లే ఉంటా అనుకున్నా. నా కూతురు మనవరాలు నాకు ఎంతో ధైర్యం మంచిగా అవుతావు, నువ్వు మంచిగా తినలేకపోయినా రాత్రి నిద్ర కూడా లేకుండే, నిద్ర కూడా పోకపోయినా వాళ్ళే ఎంతో ధైర్యాన్ని ఇచ్చిండ్రు. ఇస్తే కొంచెం కొంచెం కోలుకొని ఒక నెల రోజుల లోపల మంచిగా అయిపోయినా, పూర్తిగా మంచిగా అయిపోయినా.
As said by Miss Vasumati Devi, her traumatic event led to depression, which later branched out into eating problems, sleepless nights, and more. This is the case in which the plasticity controversy comes into play. Many believe that neuroplasticity can worsen certain conditions, despite the proof that it can better the lives of patients. The connection between neuroplasticity and depression can either go right or wrong. In such psychiatric disorders, there's a negative neuroplasticity that can be seen. This is because depression causes damage to the brain, which encourages unhealthy pathways and discourages adaptive ones. However, on the bright side, treatments to depression can halt this damage and even reverse it. Behaviors present in our lives allow us to offer healing, which occurred in this patient's life. Since her post-traumatic depression wasn't severe, with the help of her doctors and family, she was able to recover, and 7 years later, she's here, showing long-lasting remission.
How does neuroplasticity work in these cases? When you do a physiotherapy, what happens is these signals from here bring back these signals, whatever, when you do a physiotherapy, the signals take over and take the signals to the brain through the synapses, and the other part of the area besides the dead area will be taken over this function. That makes it functionable. The whatever hemiparesis was there, the weakness was there, will improve after this physiotherapy. That's a kind of neuroplasticity. So it's basically a phenomena where brain changes and adapts to different stimuli. In case of autism and ADHD, when we talk about how does autism kids and ADHD kids are improved with neuroplasticity, it's nothing like when you're giving a therapy to autistic kid, like occupational therapy, speech therapy, improving his social and verbal and non-verbal communications, you're stimulating particular areas of the brain, which improves because of repeated stimulation. There is increased myelination in that area, and improved functioning will be there. That's how the child will improve in case of autism and ADHD. There are many cases which come here to the Nilofer hospital where we see developmental delays because of birth asphyxias when the child did not cry during the birth, and infections to the brain and traumas to the brain, head injuries, and also autism and ADHD kids. In all these cases, the only mechanism we work out is by using different therapies, stimulating the brain of the child, including physiotherapy, occupational therapy, speech therapy, early intervention programs, where it causes improvements in the brain in different areas, so that the child will learn the which is deficit in the child.
That being said, it's not all beneficial if you're younger. If you're younger and your brain is still developing and organizing, and you suffer a traumatic brain injury or some sort of anatomic injury, your brain will often reorganize around that, and it will reorganize in an inappropriate manner.
There are so many cases here which comes around. If the child is around 2 years old, still is not able to sit, not able to roll over, not able to hold his neck. They come here at 1 year, 2 years of age. In those cases, when we start physiotherapy, they start gradually improving this phenomena. So people tend to ask me how this exactly works. So that is what is about neuroplasticity. When you are stimulating the other parts of your body which are deficit, the area represented by that area, particular area in the brain, will develop by increasing blood flow to that particular area and increasing nerve connection to that area, so that the function will be restored. This is what about neuroplasticity.
How does the brain heal after trauma? So it's still a very researched topic. We have this idea that there's kind of 3 phases. There's the acute phase, where what initially happens is you always have backup networks or backup pathways that are opened up once the initial pathway is kind of destroyed or disrupted. These secondary or accessory pathways to kind of regain function open up, and then subsequently later you get synaptogenesis, so you form new synapses and you have new sprouting of neurons. Even in the adults, we know now that there is development of new neural networks, and then kind of long term, those new synapses and those new neural networks kind of reorganize to rebuild any sort of function that was lost to whatever degree they can. Obviously, we can't always, doesn't always work, and in older individuals, we know that those pathways are less robust than they are in younger individuals. Right, so we typically think that the younger you are, the more adaptable your brain is, the more plastic, the more it is to kind of reorganize and itself after a trauma to compensate for what you need. And to a large extent, that's true. We do know that if there's a traumatic brain injury to a patient, when they're younger, they're more likely to be able to recover function. And we take advantage of that in certain surgeries that we do.
So after all of this, it brings the question, to what extent can your brain repair itself? With neuroplasticity, the brain has the ability to create new neural pathways, adapting to certain needs of post-trauma. As said by Dr. Dumani, there are 3 phases of neuroplasticity. The first phase of neurons beginning to die and unused neural networks being discovered. This lasts a few days. Next, new synapses are formed where neurons and other cells work together to replace the damaged ones, hence facilitating healing. Lastly, in a few weeks, new synapses appear, which is known as the remodeling of the brain. And rehabilitation and therapy can help these new pathways learn how to function similarly to the damaged ones. The rehabilitation of the brain clearly plays an important role. Once the brain does its job in creating these new pathways, it's up to us to make it work. Located in Israel, the Feuerstein's Institute Jerusalem facility, the Brain Injury Rehabilitation Center, provides comprehensive programs allowing people to recover from brain injuries affecting both their cognitive and functional abilities. Mainly offering rehabilitation for clients recovering from traumatic brain injuries, this institute creates an individually tailored treatment program for each patient following certain concepts of neuroplasticity, such as neurohabilitation, proving that neuroplasticity does pose as a hope for recovery.
מורה ומחנכת בתיכון עירוני י"ד, אבל החלום הזה לא ארך הרבה זמן, עברתי אירוע מאוד קשה. הייתי בקומה במשך 16 יום.
לורן נפגע בפיגוע, פגיעה קשה בראש. מאז הפגיעה הזאת הוא לא היה יכול לעשות כלום, לא להתלבש לבד, לא לחשוב לבד, הוא לא היה מזהה אנשים.
נפצעתי בראש, שברתי 2 עצמות בריח ו2 חוליות בגב. הדבר הכי בסיסי שהתחלתי ממנו זה היה התמצאות, פשוט הייתי יוצא מהבית ולא הייתי יודע להתמצאות.
Mark's stroke came on very suddenly and we didn't know what was happening. We went to Boston in America. They told Mark to his face that he would never be an architect, that he would never work again.
And that's exactly the opposite happened with Feuerstein. Instead of saying you can't do it, he's saying yes, you can do it.
Through the Feuerstein dynamic assessment, we can see beyond the person's present abilities. We can see his potential.
היום החיים של לורנט ממש במסלול, יש לו אישה, ילדים, עבודה, חברים, בזכות כל האנשים שהיו מסביבו, הוא הצליח לעשות את זה, וזה לא היה ברור מאליו.
חזרתי והגשמתי את החלום שתמיד היה לי, וחזרתי לעבוד בתור מורה.
בעוד חודשיים אני מתחיל ללמד. כל השנים שהייתי בשיקום, אז אני הייתי הצד שמקבל, ועכשיו אני הופך להיות הצד שנותן.
His first new job was to design this building where we eventually bought this apartment. It didn't take that long, and he was really, in every sense of the word, capable of doing what he did before.
What could be more exciting than meeting people at the end of the journey, starting new families, completing university degrees, and having new babies?
There will be some area of dead cells in the brain because of a damage or because of the clot or hemorrhage or something like that. That area gets damaged and forms a white area. So it takes some time to heal. Because of that particular area of damage, there will be dysfunctioning of different areas of body. But suppose to see an example, if you see a case of cerebrovascular accident where hypertension is there, causing a clot in the brain leading to left hemiparesis. That means he is not able to use left upper limb and left hand.
In such cases, therapies play an important role in the aspect of healing. However, technologies in this field aid to this concept.
the technologies that promotes the neuroplasticity helps in the management of these depressed patients. The non-invasive technologies that helps in the neuro-rehabilitation of depressed patients are the transcranial magnetic stimulation, repetitive transcranial magnetic stimulation, transcranial current stimulation, transcranial direct current stimulation. These are the non-invasive methods that helps in the management of these depressed patients. These are the technologies that promote the neuroplasticity in not only in the depressed patients but also in other neurological disorders like multiple sclerosis, Alzheimer's disease, other degenerative diseases like Huntington disease, etc. And in Parkinson's disease, this is a kind of neurological degenerative disease where the person becomes very slow and they have tremulousness of hands and some other features of the movement disorder. In these patients, deep brain stimulation is the technique where it promotes the neuroplasticity and promotes the functions of the patients. This is also one modality of the neuroplasticity.
Nowadays, there are latest imaging technologies like MRI imaging and CT imaging. And in MRI imaging, there is a specific sequence known as DTI imaging, in which we can see all the tracts which are going in the brain and all those things. And now, in some cases, we can see there might be a gray and white matter differences in the structural neuroplasticity.
Dr. Sandeep here is demonstrating the trauma in both gray and white matter and how he, as a radiologist, determines the trauma.
Incidentally looks dark on the CT brain, and what we're seeing here is the gray matter, which incidentally looks bright on the CT brain. And if you notice that the left hemisphere seems to be quite unremarkable, except for a dark area here, which is what is called as the edema. So this is where the brain has got a little bit of damage. And like I showed you earlier, there is another bright area which is not supposed to be where it is. Now, very often as radiologists, we would want to compare what is happening on one side of the brain to the other side. So this is a CT scan here, and what you can see is a bright area in one part of the brain, which is causing a little bit of compression on the gray-white matter junction, and this is called as the extradural hematoma. And what you're seeing here is that part of the brain which has been removed, or the skull vault has been removed, and this is called as a decompression craniotomy. Alright? So what we're going through here is the lateral ventricles, and this is the left lateral ventricle and the right lateral ventricle here. You can notice that the right lateral ventricle is slightly smaller as compared to the left side. Why is that? That is because there is a blood clotted here, which is kind of compressing on the right lateral ventricle. Alright? And this compression has to be relieved by removing the skull, the cranial wall, and giving the space to the brain to expand. So it's more or less like a pressure cooker. Since the brain is a contained cavity, whatever is occupying more space tends to push the brain towards one side. And unlike the abdomen, which is free, there's no expansion for the brain to happen, because skull is a very hard, cranial wall is very hard. So the only way where surgeons can actually create more space is to remove the skull wall, so that the brain the pressure gets relaxed and the damage is contained.
We have seen the various concepts that surround neuroplasticity, but it's easy to forget that there are real people who are using neuroplasticity to improve their conditions, and also people who may be suffering the consequences. Despite these two categories, there are also people who aren't being treated for their traumatic experiences. Meet Commodore Ranveer Talwar, ex-Navy officer and now the executive director of the Indian Head Injury Foundation, located in Delhi, who believe that the Indian medical infrastructure is inadequately prepared to deal with the number of head injuries, especially for the less income society.
The Indian Head Injury Foundation was founded by Maharaja Gaj Singh of Jodhpur. His son Shivraj had an accident, polo accident, and he fell off the horse, and the horse collided with him thereafter and had a severe head injury. And that is when the father found that there was no decent rehabilitative process in India which he could use. And if his situation was such, what would be the situation of the poorer sections of society, the underprivileged sections of society, who had nowhere to go in such kind of situations?
Still led me to see the situation in India was very scanty. The whole range of activities connected with head injury people were unaware of, and that's why I felt that this is something that needs to be attention needs to be focused on.
After witnessing the healing of his own son, he wanted a place where the poor man can come to heal.
Each rehab center is very well equipped, as good as the best in the country, and it is almost free to people with head injuries, spinal injuries, and various kinds of other related injuries, strokes, etc. And for children who suffer cerebral palsy and various other related diseases, and these are all practically almost free for them. So this is what we do as far as the rehabilitative process is concerned. Other than this, we carry out certain other functions which are related. For example, prevention is the best form of cure, and so we carry out awareness drives in schools, colleges, IITs and various other institutions amongst scooter rickshaw drivers, amongst taxi drivers and so on, and teach them how safety can be achieved through the use of seat belt, not only in the front seat but also in the rear seat, and wearing of helmets on two-wheelers, and how to provide help to somebody who has suffered a serious injury on the roads, which is called first response.
Brain rehab center in India. So for 1.2 billion people, there is no dedicated neuro rehab center.
Important because there is nobody else doing this kind of work. And when we came into being, we realized that India has about 2.3% of its population, who are people with disabilities of various kinds, and these people have nowhere to go, most of them. And a city like Delhi, for example, just a simple city like Delhi, has almost about 6 to 8 lakhs head and spinal injury people who have nowhere to go. We can only provide help for 20 odd people or 30 odd people per day, but the others have no way of getting any treatment. They just sit at home and suffer in silence. And therefore, the aim was that we should start this center, started in different cities over time, and give an example to other NGOs to follow suit. That is why our work is special, and it also provides top quality treatment to everyone, whether he's rich, poor, or whatever he may be, or underprivileged.
However, this foundation not only helps heal patients, but promotes long-term care through its research.
We carry out research as well. We have a medical director with us who is a neurosurgeon in Apollo Hospital. He's a neuro and spine surgeon, and he leads the team to carry out research work, etc. The research is primarily in the area of assistive technologies. Assistive technology means things like calipers, wheelchairs, etc., to make them so good and cheap that primarily the weaker sections can buy them, or they can be donated by various corporates to them. In collaboration with the IIT in Madras, we have been able to create a wheelchair which can become vertical, so it can make the person stand and walk as well while supporting him, and he can sit down when he wants. And so this is still in innovation stage, the first trials have been carried out, and primarily the innovation is there. The other innovation is trying to tie up with other NGOs who are manufacturing this kind of equipment and how to manufacture them cheaper, but not much progress on that.
Has any of your work related to neuroplasticity or neuroplasticity therapy?
In fact, most of it in our rehabilitation centers, it works with this area that you are talking about. Basically the brain has two sections, and both the sections perform their own functions. The left section does a certain category of functions, and the right section of the brain does certain category of functions in the human body. What happens is that if you have an accident or an injury and some section of the brain stops working, then how does the other part of the brain take over the function which is not its primary function? That function is actually to do something else. But now we want that part of the brain to carry out the activity which would support this kind of functioning. So we have various machines in our therapy centers, in the rehab centers, which help to teach the brain how to perform functions which it was not performing in the past, and do it effectively. For example, the portion of the brain that controls the movement of the right leg, and now your right leg is ineffective because that portion of the brain is not controlling it anymore. So we have certain machines that move that leg in a manner that the reverse signal goes to the brain that this thing is moving now, what is moving, and which part of the brain should look after it, and we get alternate areas of the brain to look after that portion which is now damaged. So that is basically the area that we work in. We have a number of machines which are called hand-arm therapy systems, functional electrical simulators, Rifton gait trainers. They can teach you how to walk when you don't know how to walk. Multi-frequency ultrasound electrotherapy, gait training treadmill, which can give you half the weight, and half the weight can be on the treadmill, and slowly increase the weight as your brain starts picking up how to function your legs, both your legs. Theravital movement therapy, etc., etc. We have lots of equipment which primarily deal with this. That is where neurotherapy comes in.
In a fast-moving world, we never know what can happen in a matter of seconds. Organizations such as the Indian Head Injury Foundation and the Feuerstein's Institute Jerusalem facility are helping rehabilitate people of all ages. Neuroplasticity is shown to have a positive effect, yet the controversy still stands.
It's not all beneficial if you're younger.
Sometimes it may deteriorate the condition of the child.
The brain has changed for the negative.
So in my opinion, I think neuroplasticity is something which is here to be explored and to be further investigated. And I am of the firm belief that neuroplasticity is something which is a game changer, and it needs to be thoroughly investigated, thoroughly researched, and practical uses of neuroplasticity have to be developed, algorithms have to be developed, where you actually have to train these patients affected with trauma or strokes, whether it's infarcts or hemorrhage, and a lot of these patients, I do believe, will benefit from advances in neuroplasticity.
It is easy to dismiss such ideas as neuroplasticity, ideas that don't show up in medical journals daily. We are living in an era where concepts are still being researched and studied, and professionals are just beginning to elucidate what neuroplasticity can do. We know after a traumatic injury, the recovery process is long, but with the evidence of neuroplasticity emerging, the prospects for new methods of healing are no longer so grim. There are many therapeutic opportunities that are being explored to target the changes with neuroplasticity. This research goes from gene expression to the upregulation of synaptic proteins. Our minds have the incredible capacity to both alter the strength of connections among neurons, essentially rewiring them, and creating entirely new pathways. Brains are tricky and adaptable organs. For all the neuroplasticity allowing our brains to reconfigure themselves, we are just as neuroplastic in our ability to recover and adapt. There's so much we don't know. There's so much that awaits us in the near future. This is the rescue of the human brain.